Hello, everyone. Thank you for joining us for the third session of our Whole Family Approach training series. Today's session will highlight the blending and braiding of resources for whole family approach sustainability. Our presenters for today's webinar are from Aroostook County Action Program from Presque Isle, Maine. Joining us today, back please, one slide. Thank you. Joining us today are Jason Parent, Executive Director, Jamie Chandler, Chief Operating Officer, and Wanda Osgood, Chief Financial Officer. Next slide. Our whole family approach team are members that add the magic, right, to the whole family approach sauce. We have Tiffany Marley, who is our Senior VP of Practice Transformation, Jennifer Gregory, our Director of Mobility, Learning, Design and Practice, Jeannie Chapin, she is our Special Advisor, myself, Tamaritas Hollywood, Senior Associate of Learning and Dissemination, Katie Smith, she is our Program Associate of Communication and Dissemination, and Denise Drake, who is our Administrative Coordinator. Next slide. Our promise, right? Even after 60 years of doing this work, this promise still holds true. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. And at this time, I would like to pass the talking stick to our presenters of today, ACAP. Thank you so much for being here.
Thank you very much, Tamaritas. It's our pleasure to be with you. As Tamaritas just introduced us, my name is Jason Parent. I'm the Executive Director, CEO here at ACAP.
And I'm Jamie Chandler. I am the Chief Operating Officer at Aroostook County Action Program, also known as ACAP.
And I'm Wanda Osgood, the Chief Financial Officer here at ACAP.
Well, we are pleased to be with you today to talk about our transformation experience with Whole Family, and specifically to the Whole Family transformation experience as it relates to the blending and braiding of resources within our agency. And as we're going to sort of share with you today, that really does exist. We have our Chief Financial Officer with us here, who's really been the architect on the financial side of things, but it has really involved a very close partnership between programs and finance and the entire leadership team embracing a new approach to our work here at the agency. So we're pleased to share with you sort of that journey, but before we get into the specifics of that journey, we wanted to tell you a little bit about where ACAP is and who we are. We are located in the northeasternmost corner of the country, in the largest geographic speaking county east of the Mississippi River. You can see us highlighted right there on the state of Maine. And as Denise Harlow often points out about us, much of Canada lies to our south, or at least in our area. We are north of much of the province of New Brunswick and the province of Quebec. And we are the only community action agency in the northern third, really, of our state. We're a $23 million organization with about 185 employees, and as Jamie will share with you in a bit, a wide array of programs and services within our agency. That shot in the center is of our Early Care and Education Center in the largest community in our service area, Presque Isle, taken during the Crown of Maine Balloon Festival, which happens here each August in Aroostook County. So our mission here at ACAP is really consistent with the work that all of us do across the country, and consistent with the work that the National Community Action Partnership does. And that's really to lead or collaborate to provide services that support, empower, and improve lives. And simply speaking, our vision statement is we make life better.
So just a little information about the programs and services that we offer here in our agency. So we do offer programming in the areas of early care and education, and we do so through Head Start, Early Head Start. We have childcare, and we also offer developmental programming for early intervention as the early intervention provider in our county. We offer programming in the areas of energy and housing, We offer we call it HEAP services, or as many of you across the country refer to it as LIHEAP services. We offer weatherization, home repair. We also offer opportunities for housing navigation services. We offer some support services for people who are experiencing homelessness. And we do also offer assistance to individuals who are looking to purchase homes through home buyer education courses and financial literacy and budgeting around housing and staying safe within your homes. We do also offer along with that, prevention and wellness services to help us to ensure that the members of our community are safe and healthy and have opportunities and environments that offer safe and healthy choices. And so we work very closely with our municipalities and our school departments to ensure that we have policies in place that allow our youth and our citizens to enjoy smoke-free and environments that offer opportunities for physical activity and healthy nutrition. We also provide services for the Supplemental Women, Infant, and Children's Nutrition Program, and we offer opportunities for nutrition in the areas of the CACFP program, Child and Adult Care Food Program, to ensure that our youngest of our citizens are getting the nutrition that they need while they're in programming. We also offer some oral health services in partnership with some local dental hygienists to ensure that the oral health needs of the youngest people in our communities are being met. And then we wrap all of those services around with our coaching and workforce development programs. And so we really take a family-centered coaching approach to working with the families that are enrolled in our coaching and workforce programs to not only help them to ensure that those needs that we just discussed are being met, but also putting the families in the driver's seat and letting them tell us where they want to go, and then we just offer the necessary supports to help them to achieve whatever goals they have set forth for themselves and their families.
And that effort really to get to what Jamie just talked about is something that's really evolved with our community action agency over the last 7 or 8 years or so, and with intentionality. And so as we talk about the blending and braiding of funding, it's really critical that we look back to how we got here, but also to understand that we do certainly ascribe to the Roma principle of continuous quality improvement and consistently evaluating where we're at, sometimes much to the exhaustion of some of our team members who say, gosh, can't we just keep things the way they are for a little bit? And we come back and we say, if they're not working primarily for our customers, but also for our staff members, if there are flies in the ointment, if you will, we want to fix those as soon as possible and move forward. Another sort of guiding principle by which we have moved and how we have transitioned into a greater blended and braiding environment as it relates to funding is really to let form follow function. So as an agency prior to 2016, we were like many community action agencies were across the country with very distinct departments and specific staff for each of those locations. We were what everybody refers to as the dreaded siloing. And there was work happening across the agency fundamentally because the people doing the work were intent upon trying to deliver the best services that they could. But it was very, very difficult for that work to happen because many times folks saw themselves first as working for their funding source and were living in a very heavy compliance and regulatory environment. Not that we've forsaken any of that, but we've asked to go a step beyond and steps beyond that, as we'll talk about here. And our administrative support at the agency was very limited and very small. And you'll hear about how we grew that, not at the expense of programs, but really to the betterment of programs in terms of supporting programs more equitably across our network. So as we moved through the intervening years, we really started to pilot the work of whole family with one coach initially that we placed in early care and education. And then what we really started to discover is we had that coach, and then we had more of a case manager working with other families that needed those interventions at a higher level, is that it didn't necessarily work very well to have those staff aligned in silos. So as 2018, 2019 rolled along, we learned from the initial pilot and from the scaling up of that pilot by adding coaches in other parts and other regions of our community in our county, our very large geographic county. And in so doing, really started to say, okay, how could we build the organizational structure better? We didn't take on organizational structure right from the onset. We made tweaks in our organizational chart to really allow the work to sort of help drive how we were going to align the organization accordingly. So in 2019, we really began an organizational restructure a year after we joined the National Community Action Partnership Community of Practice around 2-gen and whole family work, which really helped to provide the critical training and technical assistance we needed and the resources for our staff to be able to sort of think outside the box. That community of practice, but also our work with others and doing site visits to places like Garrett County Community Action Agency in Maryland and our sister CAP in Stratford County in New Hampshire that really helped us to learn specifically how they did things differently around the funding model for agency programs. We also began to really do the work in this time period as well as a system here in our state, as a network of community action agencies, saying that really our ability to do this work was going to need to be supported both in a funding environment in terms of working with funding sources to be able to access funds to do the work differently and to approach the work differently, because we all shared funding sources like Maine Housing for programs like the Home Energy Assistance Program. And most of the CAP agencies also had Head Start programs. So us doing this work in a bubble by ourselves was really not going to be as possible as we would have liked in order to advance some of the systems level change that we needed to advance so that we could achieve the blending and braiding, which was critical to the way that we approached the program work that we did. At the same time, we began to develop cross-functional work teams so that people would be able to really develop the muscle of working across programs. We looked at like grouping areas, such as programs that focused on youth that might have been in different traditional departments and didn't have the opportunity to work cross-functionally as much as possible. And then in that process, we also began in our very earliest incarnation of mentoring other community action agencies across the country as we came out of the National Community Action Partnership Community of Practice. And every time that we mentor another agency, we certainly learn best practices from that other agency so that, again, that process of education and continuing quality improvement obviously is ongoing as it is today. As we went through the pandemic, what we actually found as we used some CARES Act dollars at that time to increase navigation in particular so that we could really help individuals who had never turned to us for services before, who didn't really understand how to work the networks and the systems to be able to receive the assistance that they needed at that very critical time. And then when we got through that period, we actually did an assessment with our staff as we were trying to move prior to the pandemic to what we called comprehensive, or now called a coordinated intake process. And the pandemic sort of slowed our progress on that. And when we surveyed staff, and Jamie will talk in a little bit about the importance of having staff voices involved in the process. When we surveyed staff then, what we really found out is that there was a slide during the pandemic, because prior to, we had staff that were working in blended and braided positions and in specific funding sources who were really helping to navigate customers who would come in for whatever service they sought from us, to be able to connect them with other programs and services outside of even a coaching or navigation environment. And when we stuck navigators into that process through CARES Act funding, that some of that muscle was lost. So we needed to go back and we needed to rebuild some of that muscle before we could talk about what became later comprehensive or coordinated intake. Then at the same time, we were also beginning to evaluate, which is a critical component of the work and how you're going to do blending and braiding, not only for where the funds come from, but how the work is laid out. So when I first joined the agency back in 2015, our WIOA contract under workforce development was a $1.75 million contract. In the intervening years, that contract had declined to about $1 million less than that. And we had so few staff that were doing that workforce development WIOA work that not only long gone were the days of it being a department of its own within the agency, but we began to rethink our processes of, is this really specific staff doing the work of workforce development? Or is this WIOA funding source one that we blend and braid into coaching positions across the agency so that it becomes a tool in the tool belt of our career counselors, at the time career counselors, who are all transitioned into coaching positions here within the agency. And then at the same time, some of the work that was going on that Wanda will speak about in a little bit related to how we supported those units administratively was ongoing as well, which also changed the dynamic of how we blend and braid funds moving forward. And actually, in the long run, I think all three of us would argue saved positions of some really talented employees in this agency that would have otherwise been contract positions that would have gone with specific contracts. But because of blending and braiding, we were able to retain some really talented staff. And then what we really began to do, which we're working on the next iteration of now, is to lay the foundation for a coordinated intake system, which will again test and require the stretching of our blending and braiding of funding, so that we have staff working across the agency, and no matter where people enter the agency, they're able to access every service that we offer and be able to be connected with services of partner agencies, because of the knowledge that our staff has and the ability for us to blend and braid the dollars to be able to support staff in that way.
So as Jason was talking about the organizational restructure, we had done a lot of work in planning to really sort of figure out how we knew we needed our organization to look different and to function differently, but we weren't really sure exactly how we wanted to do that. But what we had done is we had gone through the community, the whole family community of practice. And so one of the foundations that we wanted to build our restructure on were the building blocks here of whole family, the components of whole family. And so we really used this model as the guide to help us in making sure that our agency was working effectively and efficiently. And we were able to take our programs and really see how they fit within these components. And so as we were going through that process, it really made the restructure a little bit easier because we had a framework for which to help us in understanding the why behind the restructure and where we wanted to go and what our ultimate goal was. And so we were able to take the programs and services that we offered, we were able to sort of group them together, aligned with the gears of whole family. And that was really what helped us to come to our ultimate, I say ultimate, we've made some tweaks and changes along the way, as you'll learn, but was really the guide for us in developing our agency restructure.
When we look at these gear shifts, we really gain an appreciation and understanding for if any one of these gears is not moving, the entire system is not working. It's not, that's the case from a perspective of the consumers that we're working with, the families that we're working with. One blockage in any of these, one gear shift not rotating, can bring the entire family and household to a screeching halt. We use this model to be able to rebuild our organization and acknowledge that that can be the case, that we can at times be the impediment when we're not helping a family to be able to stop the blockage of one of these cogs from turning, and this entire engine and this entire system from not working. But that worked very well with our program staff. But then we needed to, and Wanda was one of the leading architects of this, so I'm going to turn it over to her. We needed to sort of transition this concept of how we were working with our customers and with our families internally to the staff that was supporting the individuals who were working in a direct way with those consumers. So we looked at another system called the Matrix organization, and I'm going to let Wanda talk about how we use that system to really retool and revise the administrative part of our entity, working collaboratively with programs.
Great. So as Jason and Jamie have mentioned, we've gone through quite an extensive reorg throughout this whole process. And one of those major changes was that we decided to centralize some of the activities that were happening throughout the agency, but in different departments or different silos, if you will. So for instance, we had program directors who were doing their own invoicing and state reporting. And then we had some program directors who actually had staff under them who could help with them with that, because they actually had a little more funding to allow them to have some support staff. So what we decided to do is we actually built a a finance team that was able to extract a lot of those duties out of the director's hands and allow the finance people to do what they're strong at and allow the directors to really direct the programs and how we're serving our customers. So we created a new finance department. We have a financial analysts who now do all of the state reporting. We centralized things such as accounts receivable and accounts payable and purchasing. At one point in time, we had anybody, in different departments could do their own purchasing. We've kind of streamlined all of that and put that all under one bucket to kind of allow those opportunities for the people who are working in the direct program to do the work that they need to do with our customers. Doing all of that, we've created this matrix organization, if you will. So working across the lines. So, I have a finance team who they don't just answer to me, they answer to any one of the directors that they might be working with. And we've created that type of environment where we do work across the silos, if you will, that we really have tried to break down. So we don't consider that we have a whole lot of siloing anymore. It is very fluid within the workflow of what we're doing.
And so in terms of sort of lessons learned that we want to share with you is that though this structure and the research around the matrix organization and an organizational expert around matrix organizations that was a loaned executive to us to help us lead this work from the University of Maine system, though that was helpful, and certainly the Ascend model is extremely helpful and something we continue to use every day. One tool that we wish we had had in our tool belt when we started this work and that we have since used quite a bit, which helps staff understand the why, but also helps alleviate some of the concern and the fear, is really the role of the human services value curve. So when I came to the agency, again, back in 2015, folks were functioning in that small box there at the bottom of that diagram on the screen, and that was in the regulative business model. They were essentially getting program direction from funding sources, which is absolutely necessary, and we have not forsaken that in any way, shape, or form. But that was sort of the extent. Our staff, even in their expression of who they were, really saw themselves first and foremost as a home energy assistance program, a team member, or a Head Start team member or a workforce development team member, not a member of Team ACAP, understandably a member of Team ACAP, but not Team ACAP first. And that was actually contradictory to what these individuals, most of whom come to work for community action because they really want to change lives and they want to do some of the things that they're able to do as volunteers in their community to connect people and to help people in ways that really support them in the multitude of things that they need in assistance. And they say, oh, I'm going to go work for community action because they do a lot of good. And we absolutely do. But we could see, and Jamie's going to talk about the importance of staff voice, but we could see the frustration and feel the frustration of our staff who were seemingly feeling unable to help folks in the multitude of ways that they needed to be helped and connect them because the billable time was to one specific funding source. So we had to move outside of that regulative business model into a more collaborative business model. And then beyond that, into integrating that work. And I say that we're probably existing today, on any day, in any one of the regulative, we consistently do that. And we are consistently lauded for that work across the state and by our funding sources. But in the collaborative and integrative model is where our staff works today. We continue to aspire to continue to work toward the generative model, and that's a whole presentation of its own. But if you haven't had the opportunity to participate in a presentation on the human services value curve or introduce your staff to that, we don't have the time to go into it today, but it's well worth your time because it helps you understand the why. And our colleague who is in the community of practice with us, Dr. Cynthia Kroom from Metropolitan Community Action Agency in Nashville, Tennessee, does a tremendous presentation on her agency and how it introduced human services value curve and integrated it into their work to help staff get out of functioning solely in that regulative and business model. But it was critical that our staff understand the why to be able to help move in that direction. But it was also critical that we heard from them so that we could understand what they needed in this process.
Right. And so we had begun the process of doing some employee engagement surveys. And so we really tried to focus with these surveys to kind of not only get a pulse of, how staff are doing, but to really gauge their understanding and their engagement in our agency transformation from, this sort of traditional organization that works very much upstream and in your lane to an organization, to a matrix organization where we're working across and you may work for multiple programs. And so how does that all work? And so we employed an employee engagement survey in ACAP during 2019. And our staff, as you can see, as we were asking them questions about our comprehensive services delivery model, the majority of our staff were feeling like they were a part of it. We really worked hard to develop the Family Council, which is a group of individuals from across the agency at various levels. We had direct service staff in the Family Council. We have leaders within the organization and people from various levels within the organization that participate in that. That really, it is they're the guiding coalition for our transformation work, and they were boots on the ground working with the individuals within their program areas to help them to understand why we were moving forward. And so I think that the work that we did to get the buy-in and the engagement from those teams and from their peers really helped to reflect when we did the survey to show that the staff really felt like they were a part of this process and a part of the change. It wasn't something that was happening to them. It was something that they were, engaged in and a part of.
In fact, Jamie, some of what the staff came back and said to us in this employee engagement survey back in 2019 and complementary focus groups that the consultant who had been working with us through this transformation work heard was that get on with it already was pretty much the sentiment, because we had been we started in a pilot environment, we did some expansion work, and we were really starting to begin in 2019 to change the organizational structure and change the administrative support staff. But staff were really hungry for this process, and it was important that we understood that and we heard that in the employee engagement survey, because the plurality of voices sometimes isn't represented in the loudest of voices. And what I say by that is that obviously there were some detractors, and I think one of the things that we are very frank about with agencies that we have the pleasure of helping to mentor in this process is that I am very frank in saying that when I came to the agency and then went to a National Community Action Partnership Management Leadership Training Conference in New Orleans and heard about the great work that was being done at Garrett County Community Action Agency and came back and shared that with my leadership team, I felt like my flame was extinguished a little bit in that conversation. And I quickly realized that the team that I had in place at that time, unfortunately, was not the team that was going to see us through the finish line and get us into this great place. So as Jamie pointed out, we sort of incubated this work, the initial work, in a guiding coalition called the Family Council, people that worked across programs in the agency that had a hunger to do it and that had the levers that could be pulled to really make it happen and to bring stuff back to the leadership team. We did not have the chief financial officer in place at the time that we do now that was going to look at blending and braiding in the way that Wanda does and that Wanda's immediate predecessor did as well, to really be able to make those transformational changes. And the employee engagement survey, basically the voices of the employees said, the leadership team's not all on the same page about this, and it shows. And that was, and the employee engagement survey was developed in collaboration with the board of directors, and the results were openly shared with them. And it actually gave us, from a governance perspective, really the green light to be able to advance this work, because, staff members were small but large geographic community. We're seeing board members at basketball games and out at the grocery store and everything, and some of them had things to say that board members were a little bit concerned about the level of change that was happening in the organization. And the results of this employee survey not only helped buoy the employees who really wanted to see the change happen, which was the plurality of employees, but also be able to help us from a governance perspective to pave the way for the heavy lift on the organizational restructure that was to come. So what have we learned in terms of opportunities and obstacles for our whole family approach in terms of blending and braiding? That to that effect, just what we were talking about in regards to the employee engagement survey, making changes, in fact, to the organizational roles and the organizational structure can reinvigorate team members. We were calling on a higher purpose. And the reason why team members join community action for the most part to begin with. I had spent the first few months of my tenure doing as much job shadowing as I could and understanding the roles of all of our team members, from sitting in on a home energy assistance program appointment to riding a Head Start bus, having lunch with the kids and their teachers in the classrooms there, going out on a weatherization crew to see what the work that they were doing in their homes, and a variety of other things. And invariably, staff were all telling me, we want to be able to do more. A HEAP member told me about, having a single mother and her young child in the office the day before I shadowed her appointment, and she had an apple on her desk, and she could tell that the child was hungry and that there was probably food insecurity in the household, but felt restricted in terms of what she could do to connect that mother with other programs and services within our agency in the time that she was being paid through main housing for that particular program. And that needed to change. And that actually was helping to inspire team members to support the very heavy lift that was required. That organizational structure change and the prospect of it, though, does cause apprehension for many. And not everybody makes it through the journey, but we have had, and it's not necessarily your longest tenured member. The longest tenured member of our leadership team is actually still with us to this day and really leads a lot of this work along with Jamie and Wanda and others in our organization, because she believes that this is the way that community action agencies were intended to operate and intended to function. And just historically, through previous administrations and the like, in CSBG, block grant funding and the like, really changed the DNA of how community action agencies operate, not necessarily for the better on the business side of things. It also really brought to light to us that leaders and others in positions of authority didn't always follow through with the change process and reorganization in their downline. We continued to find sort of landmines that we didn't know were laid, and that the trust but verify is a very critically important part of ensuring that it's much more difficult for leaders to sort of fudge that, if you will, on the finance side of things, because there's financial accountability, but on how the program is actually operating and serving customers, it's important that you do sort of check-ins, as Jamie has learned.
Yeah, and also, and just because the other piece that we've learned is just because we've trained someone on a new process doesn't necessarily mean that they are executing the process as intended. And so I think that that's another piece that, as we've gone through this, and Wanda has some really good examples of this too, of, we thought that a process was going to go this way with these new blended positions, and then people kind of either chose not to adopt the new processes or just fell back into the old habits that they had prior. And so really doing that like Jason said, trust but verify, has been really important for us. And really track your data, like pull your data, have a data collection methodology before you go in, so that you can spot check from time to time to ensure that what your intended outcomes were or are, that you're actually working toward and achieving those.
And we're learning along the way that one of the things that that's necessary to do is to do that check-in really early in the process, because you can go through an entire season of something and not realize that it's not functioning the way that it was intended to. So as we enter into this new era of comprehensive intake, comprehensive intake 2.0, or agency intake as we're calling it this year, the staff is now currently being trained on that with the intentionality of going live in the month of July when a new home energy assistance program season opens. Within that first month of that season, the leadership team will be not mystery shopping, but actually participating in, setting ourselves up in the position of being a customer and seeing and testing how the system is working so that we can tweak it early on in the process and help in any gaps of understanding that staff may have had, and do additional education and training for the staff to hopefully ensure that it functions for the remainder of the season as it was intended. And certainly, Wanda, you can attest that blending and braiding is not a function of finance alone.
It is not. It really does take the work of the whole agency. Everyone from your direct staff all the way up to your leaders. Everyone has to be involved in that process and understanding what that means. So yes, it certainly is not a finance function alone.
As I was speaking earlier about the components of whole family, this is just a visual that we had adopted when we went through our organizational restructure, and you can see how we grouped our programs by type that align with these components of whole family. And we really wanted to ensure that however we were blending and braiding our funding and our programs, that we kept the family in the center, and we had family coaching as a wraparound for all of those different pieces. And so really our families enter in through our door, no matter what door that they enter into. And we are working across the organization to ensure that no matter what it is that their initial need is, we're assessing them across multiple areas to ensure that they have access to the services or the programs that they may be eligible for or may be interested in. And really this image just is a way for us to share with our staff what that vision was and how to make the whole family components real life for us and relatable to us.
So how we reorganized the agency was to take our entire organizational structure, that hierarchical organizational chart, if you will, and start from scratch. And before we even started to lay out a new organizational chart, what we did is we took the Ascend model, which you're seeing there on the right, and actually ACAPized that into our 3 concentric circles that you see there, taking all of the concepts and then plugging our programs in and helping us to sort of realign programs and services that then would be supported by an administrative unit to do what we call really building a middle for the agency. Because as I shared with you, when we started the piloting process, we placed coaching, whole family coaching, in early care and education, and we placed case management navigation coaching in the workforce development bucket. But what we were recognizing and what we were realizing is for it to truly be interdisciplinary, we needed to build a middle for the agency. And as we were seeking additional funding, that funding was coming from some non-traditional resources. Like we are funding all of our coaches have a blended and braided funding component of Assurance $16 from the Home Energy Assistance Program. That is not a traditional funding source. What happened is the first time we went out to write our request to our Maine Housing, the organization that oversees and receives the contract for HEAP for the state of Maine, and then uses the community action agencies as the administrators of those funds, is we actually had our plan rejected because it was calling for basically case management work, which we were trying to do with our coaches. So we sort of went upstream and we said, why, when our read on the plan is that we can clearly do that, was that not accepted? Well, it turns out that the state plan itself that Maine Housing had written to DHHS federally was not written in that way. So as a state network of agencies and using our administrative staff at Maine Community Action Partnership, we undertook an effort to bring together all of the research that we could find on Assurance 16 plans around the country. And we looked specifically, as we brought them together, at the states of Indiana, Connecticut, and Mississippi, specifically Indiana, which was doing pretty much exactly what we wanted to do, because the 16th assurance of Assurance 16 is to reduce the household's reliance on energy. So that's weatherization mechanisms and the like. But the second parameter for that is to reduce the reliance on programs like the Home Energy Assistance Program. So how you do that, in addition to tightening up the home, is by building economic assets for that family. And so we were able to really write a plan and bring the entire coalition together, all of the energy directors in the state of Maine and all the CEOs, to coalesce on imposing on Maine Housing that they really needed to rewrite the Assurance 16 plan to be consistent with the state of Indiana's model, and brought that model to them. But that all really contributed to our discussions around building a middle for the agency, where we were going to house our coaches. And that was really where Jamie's leadership took over, and then Wanda did the similar aspect on the fiscal side.
Yeah, so really, as we did that, we were really looking for opportunities where we could, support services across the entire agency. That was where we were really building those when Jason was talking about our timeline earlier around those cross collaborative teams. And it was all about communication. And I will say that blending and braiding is not successful if your teams are not communicating with each other. They have to be transparent. There has to be the communication because it is something that is fluid. You have a plan in place. It is something that you need to monitor on a regular basis. And that goes for the programming and the staffing. That also goes for the fiscal components as well.
I just lost my whole train of thought. So sorry. Yes, exactly as Jamie said, we have our financial team that works very closely with the director of programs and their downline to make sure that they are talking to each other, that they're working with each other across. As you see here, we have 2 director of programs. So working across those lines to make sure that the shared staff are being accounted for accurately. You might have one full-time employee, but they might code 6 different programs across the both buckets of programs, if you will, health and well-being and early care and development. So it's important for them to be talking about, who they're budgeting, where they're budgeting them, what type of work they expect them to do. And if they're not talking, then you're never going to be successful. And that works both financially and from a direct service perspective.
And so as an example, what you have in our organization today is the whole family coaching, and that coaching team is actually placed under a director of programs who's not the director of programs for early care and education, but who also has access and oversees many of the community services, the home energy assistance weatherization, the workforce development services. She has a manager who oversees the coaching team. The coaching team is largely funded by dollars that come over from Head Start, from the home energy. And Wanda's going to go over what all of those funding sources are in just a little bit when we get to the science part of this presentation, blending and braiding. But the critically important part of understanding here is that it's this middle that funding comes to. And then the compliance side is that we have staff members, for example, though that she's not the manager, one of the team members in early care and education who's responsible for the oversight of the curriculum-based or the coaching-based for the family outcomes, really does the work intensely with the manager of coaching to ensure fidelity to program in that particular case. Now, beyond what we had to do internally in order to embrace and advocate for an environment that embraces the blending and braiding of funding, is that we had to really look at, again, we did our concentric circles here and developed this, and where we looked at who are our practice and family-based outcome partners, who are our advocacy and advancement partners, and who are our training and technical assistance partners, and really begin to get information, but also to be able to really advocate for, with funding sources like Maine Housing and others, for us to be able to do our work differently. And so that has existed all the way from U.S. senators all the way down to bureaucrats working in state departments who are working with us on details of contracts for how to basically change the paradigm of how we do our work and understand that we are asking to sort of have time to prove this model, which has been successful and has won general praise from our funding sources, especially those who we had to sort of say, give us a shot on this. So Wanda.
So the science, if you will. And it's not an exact science, and it'll never look the same here as it does maybe in one of your organizations. But this is one of the tools that we use with our financial analysts and our program directors in looking at who do we have, who are the staff that we have, and what funding sources do we have to work with. And we use this spreadsheet to kind of keep track of, what's the dollar amount that we budgeted, how many people do we have? Do we have more dollars than we have staff? Is it time to hire? Where are they working? What areas are they working? And we kind of use this to plot, if you will, every month where we're at with individual staffs. The director of programs will look at where we're at with our deliverables and make sure that we are in line with the money that we've spent. Have we delivered the services? matching that. If not, then we have to do some tweaking. We need to look at, what's happening. And those conversations happen, I want to say monthly, but I believe they happen probably bi-weekly, if you will. This is a continuing conversation with the financial analysts and with the director of programs, and then right straight down to the downline, letting them know what their focuses need to be. If we've kind of, maybe we haven't had a whole lot of A16 customers come in. Why is that? Are we forgetting to mention that program to people? And there's a whole lot of conversation that happens. And without these tools and without the conversation and without the constant check-ins, you're probably not going to be successful. One person can't do it alone. So just like we're blending and braiding the funds, we're actually blending and braiding the team to work as one. They really do talk and own the process as a collaborative. So how we are set up, and it might not be how everybody decides to set up, but we have a financial analyst for each side of the house, if you will. We have our coaching and our housing and workforce, and then we have our early care and education side and our prevention program. So I have a financial analyst who's assigned to each of those directors. So it's a 1-to-1 ratio, and they work together and with the managers, within those downlines to really make sure that we have the right staff in the right place. When you're looking at a contract budget, one FTE is one FTE. That is not necessarily one person. That might be 4 people who are all working 1/4 of their time in that contract. So it's really important to try to think outside of the traditional framework of one FTE being one person. One FTE is really 40 hours per week, maybe by numerous people within your agency. And the only way if we hadn't done this, there's no way we could serve our vast geographical area, because if we have a contract that only allows for one FTE, that person could never be in all the areas of our county and be able to serve all the customers who need them.
So as an example of that, we had applied for Federal Communications Commission Affordable Connectivity Plan funding. We're successful in receiving it. I think those of you who may have also been successful in receiving know that has since been ended early because it was not reauthorized by Congress. But we applied for it, and I believe in the budget built 1.5 FTE into that equation. It was 1.5 FTE separated amongst a dozen people who are coaches, because any program or service that we look at, any grant contract opportunity that we look at, which is intended to connect customers to any specific service in this agency, becomes part of a considered pool that our coaches use as a tool in their tool belt, so that we're not having to shop one person around throughout our huge county, larger geographically than the states of Rhode Island and Connecticut combined, to be able to reach people in that service area, and at the same time allows those individuals to be really connected with the services and programs to help maximize the individuals that they're coaching with and their outcomes.
I'm sorry. And in doing this, it actually allows us to have backup in place. So if somebody happens to get done or is out sick, we're not stuck with only one person being able to serve these families. We have a team of people who can fulfill the needs of the family with this fundings that we have.
Right. And in addition, it's more than just the coaches. We have shared positions like Wanda was talking about with our administrative support positions that are funded through this, but we also have communications team members and other HR team members that are also funded directly through programs as well. And so that is how we're able to build our team and build our bench across the organization and have what we feel the strongest programs across our vast geographic area.
And you may be asking and thinking at this point, because we've also looked into it and talked about it and thinking about it, and it worked very well for our sister community action agency in Stratford, New Hampshire, when we visited them, and that's cost pooling. And we sort of shied away from doing cost pooling. It's something that our funding sources here in Maine, at least, look with a more jaundiced eye at, and something that we felt could become problematic for us, given what we got for advice from not only our auditor as an agency, but auditors from different programs and funding sources. So we really tie back, and it makes for a very interesting timesheet that a coach has to fill in or other staff members in the agency. But that's what the financial analysts and the directors of program keep a constant eye on. 2 words of wisdom or 2 pieces of advice is always keep the why in the center for yourself, leaders, team members, and change partners, and put people in positions that will drive the changes that you're looking for. I think those both can go without saying, but those have been keys to our success. So basically, I'm just going to show this quickly to demonstrate for you that this has been a continual progression. We use the funnel in the center to demonstrate the number of customers impacted. We started much more small with our pilot in 2017 with Central Aroostook families in our early Head Start program, into 2023 when we launched our comprehensive intake 1.0 model, and now in 2024 we'll be launching the comprehensive intake 2.0 model, or the agency intake model, that will reach even more customers in an integrated way, in a whole family, a comprehensive service delivery way, and require even more extensive blending and braiding and funding. So things you want to keep in mind to become adept at whole family approach blending and braiding of funds: always keep, again, as I said, the why in the center for yourself. Also, be thoughtful about incremental yet sufficiently bold change when the time comes. Try things out, let form follow function.
Yep. And as Jason had said earlier around change can be something that's really difficult for your staff, but it's really important to make sure that you're doing those assessments and to be able to demonstrate how that change has helped you to move toward each little change that you're making toward your ultimate goal. And again, making sure that you are letting the data and the feedback around the service delivery and what you're implementing, that it is driving your form and your function. So just because it may not look exactly how you thought it was going to look when you started, if you're really working to reach that outcome, that is okay, and it's okay to make those little changes and to course correct along the way. Organizational culture, I guess we can't say it enough. I mean, we're still having conversations, even though we're years into our shifting of our whole family approach and our comprehensive service delivery model. Organizational culture is something that you can't teach it. It is who you are and what you do. And so really including your teams and doing the communication and really involving them is going to help that organizational culture of change to help you to move forward. And then lastly, all of our agencies use Roma and the Roma cycle, and really using that for rapid cycle learning and using that process to help you to do your assessments, to develop your programs, and then to analyze how well you're doing.
So as we indicated, this is continuous work for us. We have a ways to go yet. We're still working to advance the work. We're going to be, as I indicated, looking at comprehensive intake immersion and the next generation planning and implementation of that. We're going to continue to focus those resources on what we call the middle of the agency, and how we can move more resources to the middle of the agency to really allow our staff to work in a blended and braided environment, but to make that happen for our customers that we serve each day. And of course, we're going to continue to learn from the lessons that we all learned during the pandemic. Our community assessment and strategic plan takes over next.
Yep. And so we will continue through that process to do continual assessment and evaluation following the Roma principles. We will do ongoing engagement and training and technical assistance, both with our internal teams as well as partners throughout the country. We're working on new employee training series to help our staff with the changes that we're implementing. Wendy, you want to take the last few?
Sure. We're participating in NCAP Peer Review Corp and Pathways to Excellence. We're sharing is helpful with others. And we're continuing our advocacy for expansion of approach to critical system reform. Renew focus on agency culture and refining and improving.
So that's our experience and our journey as it relates. And as I indicated, not necessarily just to blending and braiding, because blending and braiding alone is not something that can be done in a silo or just in finance or just in program. It has to be part of the agency culture, which we really intentionally done.
Mm-hmm.
Thank you so much, Aroostook. We appreciate that. And there are a couple of questions. I don't know if we have a little time to answer them, but I still want to let you know, do you have a pre and post org chart so I can visually see how you changed your structure for whole family approach? Can you share the list of positions within your finance department? And this is very interesting question for you. How do you specialize your staff on the requirements of all of these funds? And the last one is how does staff turnover affect their work?
So I can speak a little bit to the how do we specialize. So we've developed training models, and actually it's our staff who are working on the development of those training models, because it's our staff that are the ones that are actually doing the work. And so we've got our training practices. We do meetings, weekly meetings with our coaching team and with our teams that are blended across multiple programs to do case consultations and for them to have real-time opportunity to talk with their peers and with their supervisors on what those practices are. And like I said, it's really about making sure that we've got the proper communication pieces in place. So for us, it's really about having the protocols outlined specifically for what it is that they need to follow. So we have toolkits, if you will, and then the opportunity for them to work with their peers through weekly meetings or impromptu as needed.
What we really talk about here at ACAP is having our staff work at what we call the top of their license, if you will. And so a key part of this organizational restructure, we decreased the number of directors of program from 4 to 2 within the agency, both so that we'd have a more cohesive outlook, but then surrounded those directors of program with greater support so that they could be working at the top of their license. Similarly, when we're talking about coaches who have various funding sources and various reporting requirements within those funding sources, and unfortunately, even though we have Empower as our data tracking system and it does wonderful things, our partners, some of our funding partners, have not come to the point yet where they're looking at interoperability with Empower and allowing us to directly patch data and information in. So we're trying to work with our coaches to say, you coach, you do the work, and the people will be, and we're going to support you. We have data people and finance people that support that work happening. Without the coach necessarily having to do all the I dotting and the T crossing in that regard, so they can focus their work on families. So it allows them to have a greater breadth of understanding of the programs themselves and how they work for their customers, report and track that information in Empower, and then we work to get that information out to other funding sources and do the deliverables reporting elsewhere, so we can try to save the coaches some of those steps.
Mm-hmm. So as far as the size of our finance department, so there is myself, and then under that bucket we have we have 2 financial analysts. One of the financial analysts also functions as a finance manager, who the next members of the team that I mentioned to will all report to that person directly. So I have 2 financial analysts / finance manager. I have 4 accountants, and they do various roles from payroll to accounts receivable, accounts payable, purchasing. All of that is centrally located within the finance role.
By comparison, there were 3 individuals, a CFO, an accounts,
a controller, an accountant.
When I first joined the agency. One of the things that our board of directors, we made a covenant with our board of directors that our organizational change would be expense neutral. So we literally worked within our existing budget when we reorganized the agency to be expense neutral. And we just reprioritized. There was, for example, there was a deputy director in early care and education. That position essentially became transposed to the chief operating officer of the agency, which helped bring programs under one umbrella as opposed to just having a bench in one particular area. So that required a very dynamic shift in how those positions were funded, because they were no longer necessarily belonging to one bucket. But as I indicated earlier, we have a wonderful person who's now working in finance who was working directly for the workforce development program. That position wouldn't exist at this agency today. She would no longer probably be working for us unless something else opened up that she was interested in, if we would have left things as they were.
And we really did have to strip it down. We had to come up with new job descriptions, and we had to really, to get people to shift from the work that they had been doing to the new work that we wanted them to do. We really had to strip it down and give them a whole new job description with things that they were expected to do. And then we could sort of kind of dial it back and start blending those a little bit more. So at one point in time, I actually had an accounts payable specialist, an accounts receivable specialist, a payroll specialist, and they were very individual roles, and that is all that they did. And recently, as part of this transformation, I've actually made them again. Now they're all accounting specialists, and the idea is that they will all learn how to do roles and back each other up, so that if we have somebody who is getting done or retiring or whatnot, that we don't have a hole that needs to be filled. And that kind of answers how do we handle turnover. It's the same thing, because we have a number of people who are working in all of our individual funds. When the idea is that when one person gets done, we don't have a vacancy where the programming can't happen. There's a team of people who can step up and then help train new staff as they're coming in. And new staff coming in, this is just how we do it. They don't know it any other way.
And we know we're over time, so if the folks at NCAP could help us out by sending us any questions that we might not have answered, that we can help, I know that there's requests for information as well. We'd be happy to provide that information and get it through the folks at NCAP to all of you, so that we can. And again, apologize that we did run a little long here, but it's complicated. There's a lot to it, and it's a process that's evolved over 7.5 years here at the agency.
Thank you so much.
Go ahead, Katie, you got it.
Wanda, we do have a question in the chat. Dawn has requested your email.
Okay. Yes, I can. You guys can go ahead and provide that if you'd like.
Thank you.
Yeah, we're happy to follow up. We work with a number of agencies across the country, and we're happy to follow up. We've had some agencies come visit us, do mentor visits here at the agency, and see the work that we do firsthand, both supported through NCAP and agencies that have just said, look, we want to do this. So we welcome that as well. So please, we developed itineraries for visits that are tailored to what your team who's visiting needs, and happy to do that for folks.
Thank you.
Thank you again so much, right? Such a wealth of information and knowledge from this team. And again, we appreciate you today and every day. We will be in touch with the extra questions that come through, and we just hope that you guys have a wonderful remainder of your day today. Thanks again.
Thank you.
Thank you so much.
Thank you.